There is not a COVID-19 vaccine ready for the public just yet, but that is not stopping Minnesota from planning how to distribute a future vaccine to people across the state and across the country. And that is our top story tonight. I'm Randy Meyer.
And I'm Amy Hawker. Minnesota has been chosen to help lead the nation in strategizing. And as Paul Bloom tells us, for at least one woman, a vaccine can't come soon enough.
Tunnel. We caught up with Chris Ozanicki running Allie through a dog agility course Monday evening. A year ago, her husband Clark would have been right out there with them. But in April, COVID-19 stripped Chris of her best friend and life partner.
It's so real. It's totally ruined my life. This is forcing me to navigate a life I had no intention of living. And I would like anybody else to be saved from this.
State health officials addressing the very issue of vaccination, announcing during a daily media briefing that the state has begun planning how to implement the program to vaccinate the population. In essence, who goes to the front of the line when a vaccine is ready, knowing there won't be enough for everybody. Currently, 5 vaccine candidates have reached the final stages of research and development in the U.S., with the Centers for Disease Control selecting Minnesota as one of just 4 states to lead on this very complicated and sobering matter.
We recognize that it will be a challenge where we need to vaccinate the entire global population.
Go, go, go! I'm super hopeful every time I hear anything about it being promising.
Meantime, Chris Ozanicki, who tested positive herself for the virus antibodies back in the spring and still does not have her full stamina back, just wants to see the new disease wiped out before it shatters any more lives.
I would love for less people to go through what I've gone through.
Yeah, tough situation there. Paul joins us now live. Paul, why Minnesota for this effort, and what does it mean for Minnesotans?
As for the why, Minnesota health officials explaining it's because of the state's robust immunization program for other diseases, particularly the state's ability to reach out and connect with all of its diverse communities. As for what it means, of course, we don't know exactly when a vaccine will be ready for a full public rollout, but the morals, the ethics, the discussions, the debates that are held in terms of who gets it first, the young, the old, the pregnant, healthcare workers, the most vulnerable, those decisions will ripple out from St. Paul all across this country. For now, we're live outside the Capitol. Paul Bloom, Fox 9.